We're going to start by reading through what is cancer, and then we're just going to move through the rest of it and do some terms. We did have a handout, but we don't have it printed out for today, so we're just going to talk about them. Cool. So what is cancer? Does anyone have their definition of what cancer is? Not Doc?
Non-controlled multiplication of cells.
Yep. So the definition they have here is cancer is the general name for a group of more than 100 diseases. Although there are many kinds of cancer, all cancers start because abnormal cells grow out of control. Untreated cancers can cause serious illness and death. Does anyone know how cancer starts? So cancer starts when cells in a part of the body start to grow out of control. Cancer cell growth is different from normal cell growth because instead of dying, cancer cells continue to grow and form new abnormal cells. These cells can also invade and grow into other tissues, which is referred to as metastasizing, something that normal cells cannot do. Growing out of control and invading other tissues are what makes a cell a cancer cell. Does anyone know how different cancers differ? It's based on where they're located and if they've spread to the body, to other parts in the body, like if they've invaded other tissues. So different types of cancers can behave very differently depending on the tissue they're in. For instance, lung cancer and skin cancer are very different diseases. They grow at different rates and respond to different treatments. This is why people with cancer need treatment that is aimed at their kind of cancer. So oftentimes in cancer we talk about tumors, but it's important to note that not all tumors are cancer. Non-cancer tumors are called benign, and benign tumors can also cause problems. They can grow very large and press on healthy organs and tissues, but they cannot invade other tissues because they can't invade because they're normal cells still. They also can't spread to like other parts of the body, and they're almost never life-threatening. Lastly, for this part of it, does anyone know how common cancer is or have a guess?
Yeah, is it like
It's
56?
half of all men, 1/3 of all women. There's no exact percentage on this sheet. So that is what is cancer, and basically all of the cancer education for today. We can go through the terms real fast that we might hear. Some stuff we hear often from campers, whether they're talking about it during cabin chat, empowerment, or they just bring it up to you and hopefully another counselor or camper, because you're always in rule of 3. Just going to hammer that one in one more time. So the basic terms, we've already gone over some of these. Benign means it's not cancer, so a benign tumor is not cancer. Malignant tumors is a term for a cancer tumor. And then metastasis is the spread of cancer from one part of the body to another. Some more specific terms are stage. A stage refers to the extent of a cancer in the body. It's based on, 1, the size of the tumor and whether it is spread. Stage 1 is early stage, and then stage 4 is the most advanced stage, most like imminently life-threatening stage. And then
You want to just read these?
Sure. Stage 1 usually means that a cancer is relatively small and contained within the organ it started in. Stage 2 usually means that the tumor is larger than in stage 1, but the cancer has not started to spread into the surrounding tissues. Sometimes stage 2 means that cancer cells have spread into lymph nodes close to the tumor. This depends on the particular type of cancer. Stage 3 usually means the cancer is larger. It may have started to spread into surrounding tissues, and there are cancer cells in the lymph nodes in the area. Stage 4 it means that the cancer is spread from where it started to another body organ. This is also called secondary or metastatic cancer. Sometimes doctors use letters A, B, or C to further divide the number categories. For example, stage 3B cervical cancer.
You'll have a lot of kids who sometimes know everything about their parents' cancer. Like they'll be able to say like, oh, my dad has stage 4, 3B, blah, 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 and like go through the entire thing. And then some of the kids will be fairly ignorant to it. They won't be able to tell you even what kind of the cancer their parent has. So just something to think about is that every kid knows different amounts about it.
And then, some will maybe even know more than they'll lead on to, or that they care to talk about, because it makes it more and more real to them the more they know about it. So some are avoiding some of it too, just avoiding the reality of it, which is we just let them be wherever they are in their kind of stage of dealing with it. So then there's a few treatment terms kids also use. So chemotherapy means treatment with drugs that kill cancer cells. Another common one kids will talk about is radiation therapy. It's the use of radiation from X-rays and other sources to kill cancer cells and shrink tumors. And then the other few don't really get talked about that much, but it's hormone therapy as a treatment that blocks, removes, or adds hormones to slow or stop the growth of certain cancers, commonly used in prostate and breast cancer. And there's targeted therapies, which are newer drugs that specifically target cancer cells while doing minimal damage to normal cells. And then there's two different forms of treatment. Like, the first one is first-line treatment, which is the initial treatment used to treat a patient's cancer. And the second is second-line treatment, which is a treatment that is started when the first-line treatment stops being effective. There's also third, fourth. That's cancer education. Does anyone have any questions? That we'll probably end up Googling, but does anyone have any questions?
Okay.
I think it's safe to say we nailed that one.
I think so too. Great.